Hello, this is Madison Crabtree. I am an online RN to BSN student at Oklahoma Panhandle State University, and this is my presentation on FAYE Glenn Abdellah's 21 Nursing Problems. Dr. Abdellah had many accomplishments. She was a Korean War veteran. She also had a 40-year career in the public health service. She was a chief nursing officer. She was the first nurse deputy surgeon general. She was the first dean of the Graduate School of Nursing. She had 12 honorary degrees, 90 major awards, 150 scholarly publications, and a lot of these came from Dr. Abdellah donating the majority of her works and research around 1988 to the National Public Library. She authored 6 books, was the recipient of the Living Legend Award, and many other awards. She wrote and published a book on patient-centered nursing, and she established her theory of the 21 nursing problems. And her theory emphasizes the science of nursing, and that it is a art and a science. And her theory and work have elicited changes throughout the nursing curriculum, even still today. Okay. A patient-centered approach to nursing. This theory focuses on health promotion and maintenance, emphasis on prevention of illness and proactive healthcare. It focuses on implementing proactive healthcare nursing measures into the care plan to promote health instead of treating the illness after it's occurred. Her theory is kind of a shift from disease-centered care to patient-focused or patient-centered care. Concept of person. In Dr. Abdellah's theory, the concept of person is seen as an individual who has physical, emotional, social, and spiritual needs. And also in this theory, we use a holistic approach. So instead of treating the disease, you treat the patient. For the concept of environment in this theory, understanding the patient's environment includes their physical, social, and physiological environment, and this may vary from patient to patient. So the approach of holistic care in this theory is very important when it comes to all of the concepts. Environment is a critically important part of her theory. Nurses should consider the environment when planning care, as the environment can directly impact health outcomes. So this includes kind of 2 aspects, which is one is understanding the importance of a healthy, safe environment, but also understanding that using a holistic approach and modifying your plan of care and care plan to each person specifically means that their environment could be different depending on how the patient perceives the way that their environment should be. So we may, as a nurse or just a person, may think that one environment is better, but according to their cultural or just beliefs in general, they may be happy with their environment, although we may not think that it's ideal. For the concept of health, individuals should take an active part in their health and healthcare. The nurse should assess the patient's need and provide support and care based on that assessment, including the individual's perceived needs. The patient is treated and seen as whole, not just a disease or an illness. And health is defined as a dynamic state of health, including all the various parts of the person. So again, kind of with the other concept, the concept of health, you're going to thoroughly assess your patient, and from that you'll be able to determine what they need to improve or encourage health, but that may be different based on what they perceive as healthy. This could be for excuse me, for instance, a patient that is overweight or maybe consuming certain things in their diet that aren't healthy. We as a healthcare team may want to encourage them to lose weight or to change something about their diet, but they may be fine with the way that is, or feel that the way that they're doing things is best for them, and so it's important to understand those things. The concept of nursing, the nurse should use a holistic approach to include the patient's social, physical, emotional, and even physiological needs. You're going to use patient-centered care. The nurse should treat with a focus on optimizing health and well-being, health promotion, and improved quality of life at every stage in an individualized way. So just like with all the other concepts, you're going to very thoroughly assess your patient and kind of get to know their needs and their beliefs, and your care level is going to change based on what the patient needs, whether that's what you determine that they need, but also in a combination with what they determine that they need, to optimize their health. And this is done through every stage of life from birth all the way to death. Unique concepts of Dr. Abdellah's 21 nursing problems theory. A lot of the nursing theories are comparable and kind of intertwined in the way that they are based off of each other. Some of them are built kind of off the framework of the others. Dr. Abdellah's nursing theory focuses on patient-centered care rather than like the nursing tasks or skill level of the nurse or specific areas of the patient. A lot of the theories focus on really like a large emphasis on one concept only, like some may really focus on environment, on health specifically, on the person specifically. This theory is unique, and it believes that nursing is a science and an art. And then again, here a lot of other theories are kind of one or the other. And then using evidence-based practice is still something that we do today and a very, very important part of the concept and just healthcare in general. Assumptions of this theory. Some of the key assumptions are improved overall health and outcomes using patient-centered care, evidence-based practice, holistic care. And nursing is a science and an art and should include holistic approach and research or evidence-based practice. So this is just saying that by using these things, the patient is going to have an improved overall health and outcomes. Propositions of this theory. Patient-centered care used with all patient treatment will improve the overall health and outcome of treatment. Part of patient-centered care, treating the patient holistically, will provide a better outcome as all areas of the patient's life or needs are addressed. This approach could also help prevent some illness. And it does this by just having a thorough understanding of your patient and accepting that fully, which will improve like rapport and communication with your patient, which will encourage them hopefully to be more involved in their care, which we know will improve their outcome in any setting, outpatient or inpatient setting, or even long-term care. If patients are more involved in their care and more understanding of their care processes, they're more likely to have better outcomes. And then that nursing being an art and a science, using evidence-based practice to support correct and appropriate nursing actions, and holistic care to address all other areas to improve the outcome. Limitations of this theory. If using Dr. Abdellah's 21 nursing problems as the sole framework for your nursing care or in your nursing process, some actions and treatments could have some limitations. And then there are the 21 nursing problems are kind of categories listed here in the theory, whereas some issues that you might encounter in your nursing practice might fall kind of between the categories or even completely outside of those areas. And then also with this theory, there's the lack of specific guidelines and subsequent actions. Although, again, those 21 areas are identified and they're identified well, there's a lack of distinct follow-through guidelines. So this theory kind of gives you your framework or your basis for assessment categories, but it doesn't necessarily tell you like kind of follow-through steps. In the past, this theory has been used in addition to many other nursing theories to shape the framework for nursing practice. And I personally would say that this theory specifically has shaped it more so than a lot of others, as it's still used a lot today. The 21 problems, some are, some aren't, but then also like the emphasis on holistic care and the patient-centered care. In present day, much of the theory is applied to our current nursing practice. Regardless of the specialty that you work in, patient-centered care has a large emphasis as well as evidence-based practice and holistic care. This aids nurses in providing comprehensive care. In the future, utilizing this structure will help improve the satisfaction of our patients, which in turn impacts a lot of different aspects. In addition, outcomes could be improved. One heavily emphasized area of Dr. Abdellah's theory is the importance of using evidence-based practice. And this is an aspect that's supported kind of just across the board in healthcare. It's taught in nursing schools, different kind of medical or healthcare programs, and also even like medical schools or for other providers. Using evidence-based practice is really just kind of a standard that's taught across the board. Additionally, as time goes on and insurance becomes a larger dictator of like kind of treatment modalities, for example, GDRs in hospitals and things, it's important that facilities have good ratings, which comes from largely in part from patient satisfaction. Um, Dr. Abdellah's theory emphasizes including the patient's entire self, which includes their emotional well-being, into your practice. This aspect of the theory could be used to educate people on the importance of patient satisfaction, as we know that these go directly into like facility star ratings, which in turn affect their payment reimbursement. In using this theory, the importance for a thorough understanding of nursing practice and all its components may prompt research to get an even better understanding. Part of nursing practice is ensuring good outcomes, safety, utilizing evidence-based practice, and more. And these areas of nursing should be continually studied to continue improving care. Application of this theory for nursing practice. In a long-term care setting or a skilled nursing facility, Dr. Abdellah's nursing theory can be applied by providing the framework for the nurse to conduct a thorough assessment and determine the patient's needs. Dr. Abdallah actually thoroughly believed in using her theory specifically for long-term care and for guiding how to form care plans and adhere to them. Once a patient needs have been determined, the nurse can use a holistic approach to develop a plan of care for the patient. In long-term care settings, quality measures are largely emphasized. Using this theory, the nurse can kind of help to ensure that they are monitoring outcomes and patient satisfaction or emotional satisfaction, because instead of just like treating the illness and kind of moving on, you're really focusing on making sure that just the patient is overall satisfied and that their emotional needs as well as physical needs have been met. And then working with the elderly population, it's important to determine an effective form of communication, which is also largely emphasized in her theory. Implications of using this theory in long-term care or skilled nursing settings are more so only positive. As mentioned, Dr. Abdullah wanted this theory to be utilized especially in long-term care settings for making care plans. These include better outcomes, improved patient-centered care, and more open and therapeutic communication, which is very important, and much more. It's important for the nurse in the facility to have an effective understanding of this theory and the framework for situations that could fall between the lines of the 21 areas or situations that might be outside of those categories. So having a really good understanding of how to use this theory in practice, but maybe to be able to kind of like modify the way that you do that to your needs. Having this knowledge will ensure the nurse knows the appropriate action to take in all situations. Additionally, it should be considered that there is a possibility of difficulty in adherence to this theory across the different care areas or specialties. In long-term care settings, although it really should be, it's sometimes not always possible for the nurse to have the time and resources to go through all the areas of this theory. And we know specifically in long-term care that ratios are very large, and this is set by like state or federal governing agencies. But you may have, depending on the shift that you're working, you may have 60 or more, up to 68 patients with one nurse. And so if you were to get, for an example, multiple admissions on one shift, it's very hard to thoroughly go through 21 different areas of assessment or different areas of the patient in whole to develop a really thorough care plan and to care for them in that way. And so again, as mentioned, it's just important to understand this theory very effectively so that you can modify it as needed, depending on the specialty that you're in.